I'm Amanda Judd, I'm 26 years old and I've been a client with Global Health Clinics for about a year.
Hello, I'm David Holden, naturopath and biochemist. I've been in clinical practice for 25 years now. I have an extensive scientific training, so I bring in a scientific evidence base to naturopathic medicine. And I use quite a lot of functional integrative testing with patients, so getting benchmarks of where people's wellness is at. So we've got goals for the future to set up programs and plans, and that's precisely what I've done in this case with Amanda.
So, what was the prognosis with Amanda?
Amanda, well, your prognosis was, when you came in and saw me, I get all new patients like you to fill a Health Appraisal Questionnaire, which is a 4-page biochemical questionnaire. And that enables me to graph your nutritional biochemistry and see exactly what's going on. And it picked up that you had significant fatigue. I think you rated your energy levels at 3 to 4 out of 10, which was a real mark. That's one of the main symptoms you came in with, and it was very clear that you had a condition we call adrenal fatigue. So I targeted that as being a key area for you get maximum improvements. Also, you had significant hormonal imbalances. You were getting quite a lot of bad premenstrual tension, PMT. So for 10 days, 2 weeks before your period is usually, quote unquote, your life was a bit from hell. So we did a lot of work around that, and I suspected that there was some what we call xenobiotic loading or toxic chemicals from your environment that were affecting you because of your past history when I did the case take about your father's printing business and being exposed to solvents and other chemicals. So that was a concern. We wanted to do testing for that, and that testing did reveal a number of things. I was concerned about your level of hypoglycemia as well, fluctuating blood sugar levels. A lot of people in the corporate world, particularly with high stress, grab sugar and coffee and little quick snacks to perk them up, but it has a detrimental effect on the system longer term. And so I'm more interested as a naturopathic physician in sustainable health care. So you don't burn your bridges short term to get quick term energy. We actually want you to have longer term sustained energy over a period of time that will support you and give you your other health goals, which is what we did.
And so what was the program that you developed?
Right, well the program, I use a technology called Hemaview Live Blood Analysis, and I used that to determine that you were quite toxic and we needed to do a detox program as a priority on your liver, kidneys and bowel, which we did. I referred you to Carol Macy for some specific chemical testing, and she picked up a number of chemicals in your system, so she gave you specific homeopathics to get rid of those, and that augmented the detox program I gave you. Also, you were very minerally depleted from the diet questionnaire I went through with you, other specific signs that I looked at with you. You had several mineral imbalances, zinc and magnesium, very, very common, particularly a little bit of selenium, and others. So we built your nutrient levels up with some good nutritional support, changed your diet, which you were very open to doing, which was great, and we noticed a significant improvement as I monitored you throughout that process. So we used the Health Appraisal Questionnaire to monitor it, and as a scientist I like to test and measure, and that's probably the difference between me and the average naturopath, that I have specific tests that I use, so we've got a benchmark to grade you against. And your Hemaview showed significant improvements on follow-ups, and you started to notice the differences. Now, a lot of people get a bit impatient and think, oh, I want to feel better straight away. But when you've had a longer term condition like you had, spanning many years back, it takes a bit of time to correct it, because it's like a steam train and it's got a lot of momentum and keeps going. And we've got to slow it down and then reverse it somewhat and get you back to where you need to be. So that took a little bit of time, but you responded, you stuck with the program, and I've got to acknowledge you for hanging on right in there and sticking with it. And you took your supplements, you took the herbs, you did the detox program as I requested, and you got the benefits. And
so what were the progress, the results that Amanda benefited from?
Well, you know yourself, your energy went right up.
Mm.
So you were like an 8 to 9 out of 10. When I last saw you in the clinic last week, you had sparkle in your eyes, you had much more oomph, your PMT had pretty much gone. You were like, it was no longer 2 weeks from hell every month, thank God. And more importantly, your energy levels were more sustainable. So you didn't get these fluctuations that hypoglycemics get with adrenal fatigue. We propped up your adrenals, kept them going without having to have sugar and coffee and quick fixes. Changing your diet really helped that. So you got 3 main outcomes. Much more energy, much more clear-headed, aren't you? More focused, and you know where you're going now. More stability, and your hormones have evened right out, which is fantastic. And those were the outcomes that we wanted and agreed to when you first came in.